abduction of 40 to 45 degrees, and adduction of 20 to 30 degrees.
And you can relax. Good.
To examine the knees, begin with inspection. The skin normally looks smooth, even-colored, and free of lesions. Assess lower leg alignment. The lower leg should extend in the same axis as the thigh. Observe the knee's shape and contour. You should see concavities on each side of the patella and should find no fullness or swelling. Check the quadriceps muscle for atrophy, which should not be present. With the quadriceps relaxed, palpate the knee, starting about 10 centimeters above the patella. Using your thumb and fingers, palpate down toward the knee, exploring the suprapatellar pouch. The muscles and soft tissues should feel solid, and the joint should feel smooth, with no warmth, tenderness, thickening, or nodularity.
I'm going to check your knee for fluid now. You're going to feel me touch the inside of your kneecap.
If you notice swelling, test for the bulge sign. To do this, firmly stroke up on the medial aspect of the knee 2 or 3 times. Then tap the lateral aspect. Watch the hollow in the medial side for a bulge from the fluid wave. Normally, none is present. Now continue by palpating the tibiofemoral joint, which should have smooth margins and no pain. Also palpate the infrapatellar fat pad and the patella. Check for crepitus by holding your hand on the patella as the person extends and flexes his knee. Some crepitus is common. Next, check knee range of motion by having the person stand and perform 2 movements.
You can stand here and hold on to
You should see flexion of 130 to 150 degrees and extension of 0 to 15 degrees.
Good. Now, without holding on to the table, I'd like you to squat down to the floor and
To
stand
test
back
muscle
up.
strength, have the person rise from a squat or from a low chair. He should be able to rise without using his hands for support. Then, with the person seated, ask him to maintain knee flexion while you try to pull his leg forward.
Very good. Now I'm going to examine your feet.
Inspect the person's ankles and feet while he's in a non-weight-bearing position. Compare both feet, noting the position of feet and toes, joint contours, and skin characteristics. The feet should align with the long axis of the lower legs. Most feet have a longitudinal arch. The toes should point straight forward and lie flat. The ankles should be smooth, bony prominences with even-colored skin. You should see no lesions, calluses, or bursal reactions. To palpate the ankle, grasp the heel with your fingers and palpate with your thumbs. The joint spaces should feel smooth and depressed, with no fullness, swelling, or tenderness. Then palpate the metatarsophalangeal joints between your thumb on the dorsum and fingers on the plantar surface. Also palpate the interphalangeal joints on the medial and lateral sides of the toes, using your thumb and forefinger.
Good. Now I'd like to check the mobility.
Test ankle range of motion by having the person perform various movements. You should see plantar flexion of 45 degrees,
Goes to your nose.
dorsiflexion of 20 degrees, eversion of 20 degrees, and inversion of 30 degrees.
Good. Now I'd like you to bend and straighten your toes.
Also ask the person to flex and straighten his toes, which he should be able to do.
Good. Now push push her toes up against my hand.
To assess muscle strength, apply resistance as the person dorsiflexes and then plantar flexes his foot. He should be able to overcome your resistance.
Good. And down. You can come down to the floor now.
With the person standing, inspect the spine as well as the hips. Imagine a line from his head down through the spinous processes and gluteal cleft. The shoulders, scapula, iliac crests, and gluteal folds should be symmetrical and equal horizontally. The buttocks should be equal in size. The spaces between the arms and the lateral thorax should also be equal. The knees and feet should align with the trunk and point forward. From the side, note the thoracic curve, which should be convex, and lumbar curve, which should be concave. In pregnant women, watch for lordosis, anterior cervical flexion, kyphosis, and slumped shoulders. In postmenopausal women, especially white women, be alert for a rounded thoracic curve and decreased height, which suggest osteoporosis. Palpate the spinous processes, which normally are straight and non-tender. Also palpate the paravertebral muscles. They should feel firm with no tenderness or spasms. Check spinal range of motion by having the person bend forward and touch his toes. Look for flexion of 75 to 90 degrees, smooth, symmetrical movement, and a C-shaped curve of the spine. In an adolescent girl, screen for scoliosis by observing from behind as she bends to touch her toes. Normally the spine is straight when bending forward and standing. Also the ribs, scapula, and iliac crests should be symmetrical and equal in height.
Now we're going to...
After stabilizing the pelvis with your hands, continue to assess range of motion by having the person perform spinal movements. You should see lateral bending of 35 degrees to the right and left.
And left. Good. I'd like you to lean back as far as you can.
Extension of 30 degrees.
Good. I'd like you to twist your shoulders to the right.
Rotation of 30 degrees to the right and left.
And left. Good. Now I'd like you to swing your right leg back.
And leg hyperextension of 15 degrees.
Thank you. Good.
Okay,
Good news. Everything looks
let
fine.
me show you
Your
the
exam,
integrated
no
exam.
problem.